Doctors have many different placements during their training, and with over 53,000 doctors rotating around 66 medical specialisms and 230 plus NHS organisations, GP practices and local authorities, there is a lot of movement and changes in employment. This has often meant repeated form filling and employment checks, mandatory training and other requirements to ensure these processes can work. These are very important, but the repetition can be time-consuming and frustrating for both doctors and HR staff. NHS England and NHS Improvement, Health Education England and other partners have listened to feedback from doctors and staff all over the country and have brought together all the relevant parties, including the BMA, to find solutions to the problem. Across the NHS, different organisations operate different data systems that need to talk to each other to enable transfer of information from one organisation to another. By keeping employment records up to date and joining our various systems together, records can be safely and securely passed from one employer to the next, dramatically reducing repetition so that inductions can be focused on what doctors really need. This enables doctors to focus on patient care and safety, as well as their professional development. And HR staff will be freed up to spend more time making the NHS the best possible place to work. Approximately 3 months before your new placement begins, training programme directors will be thinking about what training you would most benefit from, and you should be thinking about what you want to learn and what you want to get out of your next placement. If you are thinking about working less than full-time during your next placement, then this is the time to make that request. You should also ensure that your personal details and statutory and mandatory training are up to date with your current employer, as this information is about to be used for your next placement. 12 weeks ahead of the start date, Health Education England will notify you of your placement, and they will work with your current employer to transfer complete and accurate data to your new employer. 12 to 8 weeks before starting, the new trust will receive prior employment records, including immunisations, vaccinations, and details of your completed mandatory training. Your new employer will also send you a welcome letter detailing any information that is relevant to your induction. They will also ask you to confirm your personal information. This is a good time to check the code of practice to check exactly what you will need to do and when, to ensure that you and your colleagues all have a smooth experience. 8 weeks before starting, you will receive your generic work schedule and you will be required to request any leave. Then, 6 weeks before starting, the duty roster with specific shift patterns and supervisors will be sent to you. This will also set out if any special circumstances or leave requests have been accommodated. The whole process will be designed to give everyone an improved experience when new placements begin. So while IDs will still need to be checked and a few final confirmatory checks made, we hope that the first day on the new job will be more focused on welcoming and orientation. We expect it to take some time for all the improvements to filter through the country, but we know how important our doctors in training are to the NHS. So that's why we're committed to developing solutions that work for everyone as soon as possible.